Sacred Heart is proud to sponsor Pensacola Histories in recognition of the Daughters of Charity who brought their mission of care to Pensacola over 90 years ago.
Hello and welcome to our continuing story of the history of Pensacola, North America's first place city. And in this episode, we are continuing the story of the evolution of healthcare delivery here in this area. In earlier chapters, we've talked about how healthcare began with the Spanish and the English settlers. We talked about the early private hospitals here in the late 19th century, the evolution that brought the Sacred Heart Hospital to as a major institution in 1916. And then in our last episode, we brought on board the new Baptist Hospital, which came here, and finally began to talk about the effect of international or national health care through Medicare and Medicaid. Well, into that same decade, the 1960s, as Medicare and Medicaid became part of our equation, and as new technological developments were bringing all kinds of new wonderful diagnostic and treatment equipment to healthcare, we also had other changes here in the overall system in Escambia County. First of all, in 1962-63, the ladies at the sisters who operated the Sacred Heart Hospital felt that the time had come for them to move from their original downtown location, and they did. They acquired property on North 9th Avenue, and in 1963 opened the first stages of their new campus. About 3 years later, they elected to close their nurse education program, which had been situated there as well. But in 1969, the facilities which had been used to house the nursing program were then transferred into a new service, and this became the beginnings of the wonderful Children's Hospital, which became and still is a major part of the care system there. As we go into the latter part of the 1960s, and as healthcare, the economics of it began to change so rapidly, another element came into the picture. Some very wise people in other cities noted that there was money to be made in healthcare, and as a result of this, we began to see not in Pensacola specifically at that time, but elsewhere, we began to see the formation of for-profit hospital systems. These were companies that sold stock on the stock market to raise capital, and they moved in place by place and put in place very efficient, very well-run hospitals that were for profit. And of course, they were a threat, at least in the minds of those who ran not-for-profit hospitals. They were a threat to the future of that whole part of the industry. Now, we do not see anything of that here until 1972, when the gentlemen, the ladies at the medical center clinic wished to have more say-so in what was done in the hospital where they served, and after offering an opportunity for a merger, for a purchase of a hospital by the medical center first of all of Sacred Heart and then at Baptist, and both boards of directors declined, then the medical center opened an agreement with the Hospital Corporation of America, HCA, operated out of Nashville, and they working together, they bought a 40-acre tract on North Davis Highway. And in 1976, first the medical center itself and then the hospital opened for service. And of course, they've been operating there ever since. Now, as we move a little also through this same period, in Century, there has become a quest for a hospital there. And there was quite a hubbub about that. There was great debate back and forth. The local medical society and all of the other hospitals said that this was certainly not necessary, and economically it was not wise for the county to get into that business still further. But the political pressures were there, and a hospital was built in Century, and for a short time it served well. About the same time, though, as we pass into the latter part of the 1970s, the Escambia General Hospital, which had, of course, had its new facility opened in the early 1960s, that hospital began to have problems because with the almost annual availability of this new expensive diagnostic equipment, the county just could not keep pace. The county budget just didn't have $1 million almost every year to invest in new scanners and the like. And so gradually, step by step, the services and what could be done by physicians at Escambia General began to fade. And so gradually the patient mix began to change there, and the patient revenues declined. And when that happened, happened, of course, each year the county had to put forth more money to maintain the hospital. And this became a lengthy, very difficult time for the Escambia County Commission, and I won't prolong the story except to say that finally in 1992 the decision was made that the county no longer needed nor could it afford to continue that hospital, and Escambia General closed. Ultimately, of course, that building was converted and is now part of the county jail system. Well, as we move farther into the 1980s, the problems that had begun with the introduction of Medicare and Medicaid and their associated costs were just driving health care costs up dramatically every year. And in 1982, 83, 84, the Congress was just beset with questions, basically, what can we do? The President Reagan and his people were desperate to try and find some way of putting a lid on these rising costs. And this was then that they came into a new system of evaluating how each case would be paid for. I won't go into great detail on it here, but this was called DRG, or Diagnostic Related Groups. And this was an idea that did put some degree of pressure on costs and prices for a time, but after a bit, of course, that literally went out of phase as well. Well, as we move into the latter part of the 1990s, healthcare in this area was now noted as a hub of our economics, because we had the West Florida Hospital, we had Sacred Heart Hospital, we had Baptist Hospital, the Navy Hospital, we had a new healthcare facility in Santa Rosa County that was doing extremely well, and consequently, people were looking to Pensacola and say, this is the hub of care. You have a growing number of physicians, and once again, where we had only 50 when Baptist opened in 1951, that number kept growing and growing, and without giving you a recitation year by year, I would tell you that into the 21st century, the Santa Rosa County, Escambia County, combination of medical people had now passed 800. And all of these people, of course, were divided into many different specialties, and of course, one of the focuses was, how do we get more people into primary care? And that was one of the concerns then, and it continues to be a basic concern for us today. Well, as we move farther and farther into the 21st century, into the 20th century, and then into the 21st, the healthcare situation nationally is in a state of flux. The great concern basically, of course, is economic, because going back to the story we told you in a prior episode, in 1951, when Baptist opened, a typical company could have provide a health insurance plan for its employees, and the employees' premium per month was less than $3. Well, as the years passed, and of course hospital costs went up, and when costs went up, that drove up prices, and as this happened, this began to affect what employers could do. Now, we have to take a little bit of look at how this operated both in the 60s and the 70s and beyond. From the 60s and well into the 70s, providing health care insurance as an employee benefit was still reasonably inexpensive, and many employers and our great automobile manufacturers were typical of these. They would give additional health care protection as a benefit instead of giving a larger wage or a salary increase. And that was fine for a time, and then suddenly the health care costs began to go like this, and the price of health insurance was like this, and the employers began to realize that they had a bear by the tail. It was getting more and more expensive to have health care insurance. And as a result of this, many smaller employers began to say, well, we just can't afford to do this anymore. And then, of course, there were thousands of people out there whose employers did not provide health care coverage. And these people who had been going it on their own now said, well, we just can't afford to have $200, $300, $400 a month as a premium cost. We're going to drop the health care that we have. And so as we move into the 21st century, you began to see all of this beginning to mushroom. We see that the hospital costs and healthcare costs continue to rise because the equipment and new things that they offer continue to rise in price. But secondly, and this was the core problem as we see it even into the early stages of the latter stages of the first decade, we see that more and more people have abandoned having their own health care insurance, and when they have no insurance, their first resource, their first alternative, of course, first option is to go to a hospital emergency room, and when that happens, sometimes they pay, but many times they do not. And this brings a huge cost benefit to the hospital, and that, of course, raises their cost base, and those people who are paying then are charged more for what they get in terms of their own service. So basically, the hospitals, the physicians are become increasingly concerned about what are we going to do. Now, of course, one of the stories that was very popular in the 2008-9 period dealt with the automobile manufacturers, because the people were pointing out the fact that it cost a General Motors or Chrysler or Ford in the neighborhood of $1,500 more per automobile to produce one than it did their Japanese competitors, because of the health care costs that the company was paying, and not only for their current employees, but also for the obligation that they had continued on for their retirees. So health care costs and insurance costs and all of the factors together were just making the whole picture of health care more and more expensive. Now, at the same time, we have to recognize that with each passing year, each passing decade, what was available for the treatment of any kind of disease was improving dramatically. Many kinds of new drugs, new treatment modes were coming along, and so people not only were being treated better, but this, of course, was one of the things that was affecting Medicare. People are living longer. At the turn of the 20th century, the average person born at that time could expect to live about 47 years. By the time we reached the early years of the 21st century, that figure was up to 76 or 78, depending on which six we talk about. So that basically a health care program such as Social Security, which was based originally on a 65-year expectation, well, people were living far longer than expected, and the same was happening now to Medicare. And as a result of this, the Medicare costs were going up, and politically this now became a major concern, because the entire country was affected by it each year. Well, as we climax the story on the story of healthcare here, we want to put it this way: Escambia County has been very fortunate. We have had, over time, wonderful physicians. We have been very fortunate in having first-class hospitals run by very able people. These people have been very conscious of their need for public service. As a result of what they have done, people in Escambia County live longer. They are more healthy as a result of this. And of course, what people are looking at to the future is, how can we control the cost of the care, and so do a better job of making it better available to people, whatever their economic situation might be. So looking back 250 years, we can say, well, we began our story way back in the time with the British period of Dr. James Lorimer, who had only the most primitive idea of what medicine was, but nonetheless did the best they could. We moved the time forward to about the year 1914, when we finally we moved forward so dramatically that finally we began to license physicians, so that their physician education became better. Sacred Heart here was responsible for the early excellent job of training nurses, and of course this was picked up in the 1950s by Pensacola Junior College, and then of course the University of West Florida became part of it as well. Everyone has an interest in healthcare. Everyone wants to live longer, everyone wants to feel better, and as a result of this, we're all interested in what is going to happen in the future. It would be wonderful to predict that we're going to control the cost of care easily. That, of course, is a question that I'm afraid will happen. Whatever will happen is beyond what we can tell you in this episode today, but it is important for us all to recognize that what we have today didn't just happen overnight. It has been an evolutionary process, and we can be grateful for the hard work that was done here by people like Sister Frances Michael at Sacred Heart, Pat Groner and his successors at Baptist Hospital, and a whole series of men and women who have served at West Florida Hospital. So basically, we are very fortunate. We have more than 800 physicians serving us, and we can hope for only better things in the future from our healthcare delivery system.